In this lecture, we will review holistic approaches to adolescent development, and we will be focusing on ages between 11 all the way up to 20 years old. Now, according to Cura.com, holistic approaches to child development focus on the overall well-being of a child, taking into account various aspects of their growth and development, including physical, emotional, social, cognitive, and spiritual dimensions. These approaches emphasize that children should be viewed and supported as whole individuals rather than just focusing on one aspect of their development. Here are some key components of holistic approaches to child development. First, the physical development. This includes ensuring that children have access to nutritious food, adequate sleep, and opportunities for physical activity to support their physical growth and development. Second, emotional development. Holistic approaches emphasize the importance of supporting children's emotional well-being, helping them learn to identify and regulate their emotions, and providing a nurturing and supportive environment that promotes positive emotional development. Third, social development. Social development involves helping children develop healthy relationships with others, teaching them communication skills, conflict resolution, empathy, and cooperation, encouraging positive social interactions, and providing opportunities for children to engage with peers and adults are key aspects of supporting social development. Next, cognitive development. Cognitive development focuses on supporting children's intellectual growth, including their ability to think, reason, problem solve, and learn. Holistic approaches to child development emphasize providing stimulating and developmentally appropriate activities that promote cognitive growth and learning. Next, spiritual development. Some holistic approaches also include spiritual development, which involves helping children explore their beliefs, their values, and their sense of purpose. This can include fostering a sense of connection to nature, community, or a higher power, and supporting children in developing a sense of meaning and purpose in their lives. Next, family and community support. Holistic approaches recognize the importance of the family and community in supporting a child's development. Providing a supportive and nurturing family environment, as well as access to community resources and services, can play a critical role in promoting holistic child development. And next, individualized support. Recognizing that each child is unique, holistic approaches to child development emphasize the importance of individualized support and tailored interventions based on the specific needs and strengths of each child. Now, by taking a holistic approach to child development, caregivers, educators, and other stakeholders can better support children in reaching their full potential across all domains of development. According to NewportAcademy.com, today's teens need mental health treatment that goes beyond talk therapy. A holistic approach addresses wellness on every level. That includes body, mind, and spirit. Teens flourish with a holistic approach to care. In addition, an integrated approach treats the underlying causes of self-destructive behaviors. This is ideal rather than just treating the symptoms alone. The practice of holistic medicine integrates conventional and experimental therapies. This prevents and treats disease. In addition, it also promotes optimal health. Holistic medicine practitioners and holistic therapists believe in wholeness. The whole person is made up of interdependent parts. If one part is not working properly, all parts are affected. This understanding informs holistic patient care. When it comes to teen mental health, holistic treatment addresses the whole person. Therefore, it is more comprehensive. A traditional approach addresses a single element of symptoms or behaviors. Consequently, a teen's physical, emotional, and spiritual needs are equally important. A holistic approach to teens' mental health considers each teen's gender, personal history, psychological development, relationships with family and peers, emotional self-regulation, sense of connection with self, cultural and ethnic factors, physical and behavioral needs. Now, holistic teen treatment is based on the belief that compassion is key. Unconditional love and support is necessary for healing. Now, in my next series of lectures focusing on the adolescents, we will talk about puberty, what that is, cognitive development in the adolescents, Erik Erikson's stage of identity, also teen sexuality, and what is known as the emerging adult.